So let's say that you've had an OCD fixed by either drilling, or let's say you've had an OCD fixed by screws. The goal there is obviously it heals, but in some cases it doesn't. And there's even more extreme cases where you get the patient that has a piece that breaks off and it becomes an emergency to take it out. Well, in some cases we can still save that. And we've saved it in patients up to their 30s. Open growth plates are better, but even with closed growth plates, it's still sometimes worth an attempt if there's good cartilage and bone. And I've done this in many cases. If it's not attached, but it's still floating around the knee, it can be living on its own. And so what we do is we still do that same screw technique. Again, I still like to go back and check either with an MRI or a repeat scope to make sure that it's healed well, because not every time it does. And the success rates are in the 70s to 80%. Again, depending on the amount of bone left on the cartilage piece. If it doesn't heal, generally we need to remove it, but then unfortunately there's a hole in the cartilage. And this is where cartilage surgeons who have to practice more advanced techniques may get involved. So if it doesn't fully heal, you'll still have a hole there. And so as a result, there are various treatment options. The problem is you need to replace the bone and the cartilage. So there are different techniques. There are things such as we had talked about before, a Macy, where we can do a sandwich technique. There are techniques where you could do, if it's smaller, you could do something like a biocartilage, which is where you kind of microfracture that area, fill it with bone graft, and then put some juvenile cartilage over. Those are reasonable techniques, but really the gold standard for this is a cartilage transplant. And to be honest with you, this is one of the most common reasons I do a cartilage transplant. And this is much more of a common treatment in patients that are above the 25-30 range, where basically they've had this for a while, their growth plates are now closed. This option works really well. Again, the key here is still to check alignment, etc., because it's most likely on the condyles. Patients do well with this with around 85% success up to 10 to 15 years, and the data would show high return to sport. Again, this diagnosis, though, is important that you make before any damage is done to the meniscus and other parts of the knee.